News Night on Twitter. All right, providing answers tonight, Fox News medical contributor Dr. Jeanette Neshwat, also orthopedic surgeon Dr. Asghar Husain, and former Army flight surgeon, and also a congressman from Tennessee, Mark Green. Thank you all for being with us tonight. Great to have you. Our next question comes to us from My Two Cents. Does having had a pneumonia shot offer any additional protection against COVID-19? Dr. Husain, what do you say?
Yeah, so the pneumonia shot is a vaccine against a bacteria called strep pneumonia, and it does not give you any protection that we're aware of for COVID-19.
Okay, so don't count on that to protect you there. Mary McMasters is the next Twitter question for us. She says, myself and husband, both 60. He's in excellent health. Me, COPD. He works nights at Walmart, stocking and now cleaning. Am I at high risk of him bringing it home to me? Dr. Husain, what would you advise this couple?
Yeah, so perhaps. So COPD is a disease of the lungs, and we know that COVID-19 will preferentially affect lung tissue. So what that means is your husband needs to take some precautions when he gets home. You know, social distancing is kind of hard at home, so many people are not advising that that is the case. However, washing hands with soap and water and changing clothes, some even recommend taking a shower, those are some good precautions to at least take. Those are actually what I do as well.
All right, take that extra step when you get home. I want to start right up another Twitter question. This comes to us from Reactionary Info. Is there anyone looking at herbal or alternative approaches to combating coronavirus? Dr. Husain, I heard some of this coming out from China. There's been some conflicting information and some controversy about them talking about potential herbal remedies. Would there be any?
Right, so we all know how popular herbal and alternative treatments are in general, not only in this country, but in China. However, we also know that there is no scientific evidence that would support the use of herbal or alternative remedies in either preventing or treating COVID-19 infection. With that said, there are many anecdotal reports about it being used, especially in China. They had several groups that they looked at, but we don't have enough evidence to really support it. With that said, it doesn't mean you shouldn't take it, but at the same time, we don't have any evidence to support making that a recommendation.
Okay, yes. Jay May tweets in, there has been a lot of attention about the elderly with underlying health conditions being most vulnerable. My question is about my underlying health condition, adrenal insufficiency. If school goes back in session, should I stay home or should I go back? Dr. Husain, with that particular medical issue.
Right. Well, as of right now, my answer would be stay home, only because adrenal insufficiency is still considered to be a vulnerable population. And one of the reasons is one of the treatments that we use is the use of steroids. And steroids at this point in time would pose an elevated risk in dealing with COVID-19 and is associated with less ideal outcomes. So for the moment, with what we know right now, obviously we're learning a lot as we go. My advice would be to stay home.
Okay, Dr. Husain, let's start with you. Bobby Torres says, does the HIPAA or privacy law on medical information apply at this time? And I know from my years ago as an employment lawyer, I mean, this primarily has to do with medical providers and a number of other entities, but we're getting this question, it seems, in the context of a lot of people wanting to know if their coworkers have been sick or diagnosed and being very, frankly, upset that their employer is not filling them in. Tell us how this all works together at this point.
Right, so the idea is really to protect our own health information, and given that we are currently in an emergency situation with this pandemic, the HIPAA has been modified to allow for not getting consent from the patient in situations that will directly help the patient. So I'm summarizing a whole bunch of really boring guidelines, but basically what they mean is if you are in need of a medical assistance and someone taking care of you or someone involved in your team knows that you're COVID-19, then they can transmit that information to your health provider without your consent. So generally these are meant with the intention of trying to help the patient, help provide medical care, help save your life.
Renee Ventura, can you ask the panel if the virus can attach itself to pollen and ragweed in the air? We're going into pollen season, especially here in Florida. Dr. Husain.
No, in general, the virus doesn't need anything to attach to, and so it can survive in the air on its own. And as has been pointed out before, there have been some studies that are showing that it can survive for perhaps even a few hours in the air. The thing is, we don't really know what is the actual dose that's out there. What is the air quality? We know temperature, humidity, airflow all play a role, but generally, no, it doesn't really need anything to attach to.